Good afternoon, sir. Today I'm going to demonstrate about suctioning. The first step is assess the patient's vital sign, breath sounds, and appearance prior to suctioning. Um, just like choking or another sign of to uh, prior to suctioning. Next is obtain the organized equipment needed such as bag valve bag valve mask, sterile suction catheter kit, um, sterile normal saline or sterile water solution, sterile gloves, um, personal protective equipment such as goggles, mask, and gown. Uh, and suction source or wall mounted or portable. And another one is connecting tube, generally 4 to 6 feet. And next is explain the procedure to the patient or significant other. This is to gain coordination of the patient and to minimize the anxiety about the patient of the patient. Next is wash your hands. Wash your hands and put on the personal protective equipment or the PPE. This is to guard yourself from the secretion of the patient. Uh, Next is slightly open the package of the suction catheter and attach to the suction apparatus. Next is open the sterile saline irrigation and pour into sterile cup. And then don sterile gloves and turn the suction apparatus on and adjust between 80 mm mercury to 120 mm mercury using your non-dominant hand. And hold the suction catheter with dominant sterile hand while connecting suction source to suction catheter with non-dominant hand or non-sterile hand. Note that throughout the procedure, continue to hold sterile suction catheter with dominant hand or sterile hand. Next is suction small amount of sterile saline by placing non-dominant hand or non-sterile thumb over the suction port. I cannot demonstrate it more, sir, because I don't have any equipment or any suctioning material, sir, to provide. So let's proceed to the other step. The other step is hyperoxygenated patient with 100% oxygen at least 30 seconds using the ambubag or mechanical ventilator. And then next is insert the suction catheter into the endotracheal tube using a slanted downward motion until resistance is felt or cough is elicited. This note that do not apply suction while inserting catheter. Next is apply intermittent suction with non-sterile or non-dominant hand thumb while withdrawing catheter in a circulatory motion and rotating between the thumb and finger of sterile or non or dominant hand. Note that suction time is limited to 10 seconds only, 10 seconds or less. And then place the oxygen delivery system between the suction by reconnecting two ventilator or connecting to oxygen source. This is and note that after catheter insertion, allow the patient to return to baseline oxygen saturation level or better before resus- resuc- resuctioning. Better before resuctioning. Next is place the tip of the catheter into the sterile saline and apply the suction. And allow the patient to rest for 2 to 3 minutes and repeat suctioning before 2 to 3 minutes. I apply suctioning procedure 2 to 3 times as necessary to remove the secretion. And then reattach the source to the endotracheal tube. Attach the source to the endotracheal tube and then disconnect the suction catheter, wrap catheter around finger and remove gloves over catheter. Next, discard the suction catheter appropriately to the infectious waste bin. And then reassess the patient's vital signs, breath sounds and oxygen saturation. And then remove the gloves and wash the hands. And lastly, do proper documentation. Note that documentation, the date and time of suctioning, reason for suctioning, patient's tolerance, changes in the breath sounds, color, consistency, and amount of secretion removed, and current MD suctioning orders. That's all.